Alright, this is just to give you a brief idea what actually happened to Lyn and what the problem was. Initially, she had a clot build up in an artery in her lower leg, and what happens is that part of that clot breaks off and it travels up through the circulatory system of the body, and where it ends up is this is the rib cage. We'll just take this off. It's got the lungs. This is just the heart. So what happens is the actual blood flows up the veins. So it's called what Lyn actually had was a deep vein thrombosis. So it actually travels up the veins. So if this is Lyn's heart, what would have happened is the clot would have travelled up into her heart. It would have gone into her right atrium, and then what happens is it goes, as the clot passes through, it passes into the right ventricle of the heart, and then as the heart contracts, it pumps the right ventricle supplies the blood flow to the lungs to be reoxygenated. And what happens is with a deep vein thrombosis, if it's big enough, as it goes through the right and left pulmonary veins, it will actually block off the blood supply to the lungs. So what happens is, even though you're breathing, the oxygen is going into your lungs, but the blood's not there to pick it up and reoxygenate and go through. So what happened with Lyn is that she was breathing, but the actual blood supply to the lungs wasn't there to be able to pick up the oxygen. So that's when basically what happened when we found Lyn is that she looked like a goldfish lying on the ground trying to breathe very deep and very rapidly to try and pick up the oxygen, but there was no blood supply going into the lungs. What actually happens then is in hospital, our treatment for Lyn was multiple. She had also, because what actually happened was because of the shortness of breath, Lyn also went into a bradycardic rhythm. So we had, basically what that means is her heart was basically just about to stop beating, so we actually started CPR and to actually try and force the blood through to her lungs and give her some medication, which was adrenaline and atropine, to increase her heart rate. And then when we get to the hospital, what they do is they give medication to try and break that clot up. So what happens is the clot gets broken up in the lungs, and hopefully the blood supply will be able to pick up the oxygen and reoxygenate the tissues. So basically that's what happens. Is it's just if you can imagine here, you can see it. This is where the right and left pulmonary arteries. If you get a block here, which Lyn's block was 9 inches, the actual clot we believe was 9 inches long. So it was a massive clot and would have blocked basically all the way through. So there would have been no blood supply to the lungs at all. So
is that what causes cardiac arrest then?
Yeah, basically, well, what would happen was she'd have had a hypoxic arrest. She'd have had no, because there was no oxygen in her bloodstream, her tissues would have started to die, because basically your tissues need oxygenation and sugar, and because Lyn had this blockage, the actual blood was not getting to where it needed to be. So, and what actually happens, one of the things that what Lyn also had was, as the blood comes in, it can't go anywhere because it can't pump out. It starts to build up and backflow, and all these veins start to get bigger and bigger and bigger, and Lyn actually had some fairly large veins in her neck, which is another sign that she had a pretty big block going on. Well, we also believe what happened with Lyn as well is when they give her the medication at the hospital, which I'm pretty sure would have been, did they actually state they did use streptokinase? Basically what streptokinase does is break down clots very quickly. It's like a super aspirin basically, but it also, what we also think was happening with Lyn is that she might have had a small bleed up in her brain, and if you give the problem is with that drug is it will make you bleed, makes your blood very thin and breaks down the clot. So what happens as well is it breaks down the clot, but if you're having a bleed as well, it will increase that bleed. It makes the bleed. So what happens with your body is if you have a bleed, it automatically will try and clot the blood to stop any bleeding, but the drug they give Lyn actually
stops it.
it increases the bleed. So I believe yours was your right side, the bleed was your right side of your head?
Sorry.
Your left side of your head.
Left side.
Left side of your head, and then that affects the right side of your body. And that's where Lyn's, realistically, the only effect Lyn's got left is loss of power to your left hand, isn't it? To your right hand. Initially thought she might have had we were treating her for a bleed as well because one of her pupils was dilated and the other one wasn't, so that was on scene as well. So that's also a pretty good sign that there's been a cerebral bleed.
Yep.
As well as that she had a bleed on the left side of her brain and they give her streptokinase, which basically will increase the bleeding. If your skull is actually covered in a membrane, and what they have to do is relieve the pressure. So what they did with Lyn as well, because she was bleeding and it was on the left side of her brain and it was causing damage to this area of the brain, they actually did a craniotomy on you, didn't they? Or did they do boreholes? Actually, surgically remove part of Lyn's skull to relieve the pressure. Because if they don't relieve the pressure, what happens is the brain just keeps pushing, and it will go down and start to push on the. It's basically called coning. What happens is you can't survive because the brain gets pushed. Basically, it's trying to squash it down through the top of your spine. So, and that's back here. So what they do is either do boreholes, and whatever the area is, that after a scan they'll look at it and they think, right, this is where we need to relieve the pressure. But in Lyn's case, they actually took a large piece of skull out and left it out. So the swelling, I think it was for a month. So the swelling would actually go down. So it was what you consider a fairly large, significant bleed if they've got to remove part of your skull.